1.5 miles away, Dr. Ben Clark and paramedic Bill Leaning have been called to another cardiac arrest.
Clark and Well.
Yep.
Left into that garden.
Okay. So we've just been tasked on a cardiac arrest who was choking and seemingly now in cardiac arrest.
A 48-year-old man has collapsed at work. He is unconscious and his heart has stopped.
Can you show us the way?
London ambulance paramedics are already on scene and have just shocked Mark's heart and got it beating again. But Mark's not out of danger.
His heart tracing showing that he's having an acute heart attack at the moment.
Mark's heart is still struggling to beat properly and could stop at any moment.
Mark is still impossibly unwell. His heart has stopped, he's been resuscitated and it's beating again. But the reason why his heart stopped in the first place is still there. It's the blockage in the blood vessel. And until we get that opened up, he's at risk of going back into cardiac arrest and he is still at risk of dying. I'm just ringing up about a PCI referral. I've got a 48-year-old male who's had a witnessed cardiac arrest, 15-minute downtime.
So what we're doing is we're about to transfer him straight to the PCR lab, the cath lab, to try and reverse that heart attack.
When architect Mark collapsed at work, a colleague performed CPR on him for around 15 minutes.
Co-workers have done very, very effective CPR. When the ambulance arrived, he needed 2 electric shocks to restore his heart into a normal rhythm.
Some of the vessels in his heart are blocked. They've already stopped it beating once. Mark needs to get to the heart attack centre, where they can permanently unblock these vessels. Without the swift actions of his colleagues, Mark could have died.
What you guys did was exactly the right thing to do. It's absolutely brilliant, so thank you very much. All right, and so we'll hopefully get him sorted now.
Mark owes you a beer.
Most definitely does.
Ben has to get Mark to the heart attack centre immediately. For every minute the vessel is blocked, his heart muscle is dying.
This is probably the most dangerous time for him outside of what you guys were experiencing. But he definitely needs aspirin and GTN, and we just need to get out and get going.
Even though he was receiving CPR, Mark was clinically dead for more than 15 minutes and has no real memory of what has happened.
So you had a collapse at your desk, and what seems to have happened is your heart went into a very dangerous rhythm, and one of your co-workers, I think it's Paolo? Yeah. Paolo actually started doing some chest compressions on you, which is exactly the right thing to do. And so Paolo did that until the ambulance officers arrived. So it was Paolo and the ambulance paramedics that have actually saved your life today, sir.
Really?
And what your heart tracing shows is that you're having a heart attack.
Really?
Okay.
As Mark's heart vessels are blocked, Ben gives him aspirin to thin his blood.
I'll probably go aspirin and morphine, yeah.
Aspirin and morphine?
Yeah. Aspirin works to prevent some of the clots building up in the arteries. That's essentially why. Very simple medication, but works very, very well.
Ben hands Mark over to the cardiac team, who will perform a procedure to unblock his heart's vessels and hopefully stop his heart attack.
Can you show us the way?
2 months ago, Dr. Ben Clark and paramedic Bill Leaning were called to 48-year-old Mark, who had suffered a cardiac arrest at work.
This is a classic example of why first aid is just imperative. This is a man who has had some chest pain on and off during the morning, and like most people I expect, he kind of ignored it and didn't think much of it. He had a witnessed collapse at work when his heart went into a fatal rhythm, and one of his work colleagues immediately started doing CPR.
Just gently work with us, mate. Work with us.
And his actions meant that by the time the ambulance got there, his heart and his brain were still getting reasonable levels of oxygen.
Mark's colleague and friend initially thought he was choking.
I thought he was suffocating. He was trying to breathe. So it was just my, I would say, natural instinct to perform the CPR. I started the CPR for 20 minutes, and I realized that when I was stopping, Mark was stopping to breathe as well. So after the first round, I decided to go without any stopping until the paramedics arrived.
When Ben got to the scene, he realized Mark was still in the process of having a heart attack.
As the morning went on, I began to feel a bit nauseous. I was sweating a little bit. I felt overheated. My chest started to get tight. And the classic sign of a heart attack, you know, my left arm started to hurt. Very quickly, my vision just went to spots and stripes. And then my screens just disappeared. And I think that's when my heart stopped. After that, I don't remember anything.
Mark was admitted to the heart attack centre, where stents were placed within his blocked vessels to try and prevent another cardiac arrest. He knows he owes his life to his friend Paolo.
I was very grateful that Paolo was here in the office. Thankfully, he was on hand. If I hadn't received CPR, I don't think I would be here now. Very quickly, I think my brain would have shut down and it would have been unsalvageable, I think.
I'm using more Revit.
Okay, that would be a good idea.
And the new series of Trauma Doctors continues at the same time next week.